So why don't we actually dive into the site itself? All right. So this is HealthCare.gov. It is live. You can go check it out, and would encourage you to do so. This is the home page. As you can hopefully already see, it doesn't look anything like a government website. In fact, that was the best compliment we got from these 18 different groups of consumers, is that basically this doesn't look like anything y'all have ever built ever, which we actually took as a great compliment. So the marquee attraction is this big blue box, explore your coverage options. So let's actually go there. This is the insurance options finder. And I'm going to just do a couple scenarios just to show you how a consumer would use this. So let's say I'm a 46-year-old in West Virginia who's just lost his job and is in a tough place and needs to find health coverage. It actually asks me to pick a descriptor. I have high blood pressure, let's say. So I'm going to pick individual medical condition and hit next. Just a few more questions. I'm losing the health insurance I had through work. I'm between 26 and 64 years old. None of these apply to me, but I am finding it difficult to afford insurance because I just lost my job. I hit submit. The portal thinks, and boom, 8 options that I should look into. One, which I didn't know, if my wife actually has coverage through her employer, I may be able to actually sign up for that plan based on my circumstance. I can learn about something called COBRA to potentially extend my coverage. I can look at health insurance plans available to me and my family in my area. So let's click Learn More there. It asks me for my zip code, so let's pick 26506, zip code for West Virginia. Thinks, and boom. Basically pulls up a list of options in my area. Now, this is something that's actually very important. This is actually what Karen Politz in our team calls warning flags, which basically says, look, right now in West Virginia, the individual insurance marketplace is not a walk in the park. Insurers can actually deny coverage to me because I have high blood pressure. They could charge me more because I have high blood pressure. And the benefits may not be that great. But it also actually lets me know that the provisions of the new Affordable Care Act will actually change this going forward. So I have reason to be optimistic about the market's evolution over time. But in the meantime, I can actually look at private insurance options. And so the portal actually pulls up the carriers that are actually selling policies that are open for enrollment in my area and how many there are. And let's actually look at Mountain State Blue Cross Blue Shield, which has 5 plans available. And the finder actually then shows me 5 plans that are available to me. And I can check out Super Blue Plus 2008. I can click View Plan Benefits, and it jumps to Mountain State webpage. It tells me the benefits for Super Blue Plus 2008. I could also actually check for my doctor and click on that link. And it'll pull up, again, a Mountain State page where I can type in my doc and figure out whether the doc's in the network. And I get contact information as well about how to contact the plan to learn more and to apply. And as the Secretary said, coming October 2010, will be price estimates. Now, actually, as you'll see, not every link is actually provided. Not every link has been actually provided by the carriers. It's actually an interesting exercise. We went out and asked the carriers for information. And in the first round, we got actually a terrific response in terms of what plans they had available by zip code and contact info, but a less than terrific response in terms of links. And so we said, look, these links would really be useful to consumers. We'd really like you to provide them. We think it's actually good for everybody if you do. So we'll give you a chance to actually provide that in the next week before we actually take the site live. But if you don't, we're going to actually put no link provided for everyone to see on July 1st. And sure enough, insurers responded quite energetically, and we got actually a bunch of additional good links. And so I think right now, 71% of the View Plan Benefits links are actually populated. 89% of the check for your doctor links are populated. And about 54% of the drug coverage links are populated. And as you'll see when you explore the site, the links are of varying quality. So some of them, like the Super Blue Plus, jump me straight to a page that actually describes the benefits. Others actually take me to a site where I got to hunt and peck and try to find Super Blue Plus and find the benefits. But one of the things that's interesting about markets is that products that are better understood by consumers are more likely to be bought. And so we're hopeful that by creating this transparent playing field, that will put pressure on insurers to actually improve these links over time and make it ever more useful for the public. I can also learn about, let's click on, let's see on the right there, it's got my list of 8 options, pre-existing condition insurance plan. So as the Secretary mentioned, we're also rolling out today, it's a busy day, these new pre-existing condition insurance plans are available to folks who have medical conditions. And I can actually click there to learn more. There's also actually Access West Virginia, which is another state high-risk pool plan program that is currently open to me and that I should look into as well, with a contact number, eligibility criteria, view plan benefits, etc. I can also learn more about Medicaid. I click on option 6, and it tells me what Medicaid is and what services Medicaid covers are particularly relevant to me, and I can learn more and look to investigate that and enroll in Medicaid if that's appropriate. So there are options that get presented for me as a West Virginian who's in a tough spot, and I'm feeling a little bit better about life now, a little more optimistic.